How to study for NAC OSCE exam and successfully clear it. In this video, I'm going to provide a step-by-step guidance all about NAC OSCE, and let's do this together. For those of you new here, I'm Dr. Rajiv Iyer. I'm a board-certified physician practicing in Philadelphia, USA. I used to work in Canada before, and now I guide hundreds of international medical graduates like you. So first of all, what is NAC OSCE? I have personally taken an OSCE exam in the US myself. The concepts of this and NAC OSCE are pretty much the same. So essentially, irrespective of whatever your specialty of interest is, you have to think yourself as a primary care doctor in the NAC OSCE exam. There are 10 stations or 10 rooms. You walk into each of these rooms. There will be a patient or an actor pretending like a patient, and then you have to ask them their story, do a physical examination, come up with a diagnosis, interpret all the lab work, and then provide management. You're not going to physically do anything, but you are going to talk about all this. Plus, you're going to counsel them based on whatever their problem is. All this is how exactly it's done in a Canadian or a US healthcare system. This is exactly what NAC OSCE is. More than medical knowledge, there are a lot of things that is getting assessed here. Alright, now let's look on to what else is there in this exam. The next thing is, who is this exam for? This exam is only for international medical graduates. Are you someone looking forward to do residency in Canada? Just comment a yes or no below. If you are someone who is looking into get into a Canadian residency program, then the expectation is that you must complete this NAC OSCE exam along with your MCCQE1. Now, if you're someone who is eligible to apply for a clinical fellowship or directly as an attending physician in Canada through various other routes, then you do not have to do this NAC OSCE exam. But for those who are interested in residency, this is a must. Next question is, when can you take this? The sequence of taking the exam does not really matter. You can take your MCCQ1 first and then the NAC OSCE, or you can take the NAC OSCE first and then the MCCQ1. In order to apply for a Canadian residency program, you must be either a Canadian permanent resident or a Canadian citizen, but in order to do these exams, you do not have to be one. These exams are physically done only in Canada, so you do have to travel to Canada in order to take these exams. These exams are done at specific periods of the year, and the link for this exam is on your screen right now. And I've also left this in the description below. What is the purpose of this exam? As you transition into Canada, Canada wants to test you in two different ways. So one is your medical knowledge through the exam called MCCQ1, and the other is your communication skills and how you approach and things like that through this exam called NAC OSCE. This is an OSCE based exam, which means you actually do this exam in front of an actor. There is an examiner assessing you while you're doing all this. Now we'll talk about the exact structure in the next few minutes of this video. So the next thing is, how is the exam structured? This NAC OSCE exam has 10 stations, meaning 10 different rooms or 10 different what I would call as a clinical examination room. For example, a 10 different doctor's office. Let's put it that way. So it's in a huge building where you have 10 different doors. You would walk in and then you would see a patient or an actor in each of these rooms. So bottom line is, they're assessing your clinical skills, your communication skills. And when you see a patient in Canada, when you start practicing, can the patient understand what they're saying, and can you understand what the patient is saying? This is all they're looking at. And this is done by using actors, not real patients, but people who are going to act like patients. Now, on the day of the exam, let's say you start with one station. A station is essentially you're standing outside the door. The exam would give you 2 minutes. They would have a sheet of paper kept outside the door explaining the situation about the patient. Now let's say the scenario might run something like this. A 60-year-old man has come for a clinic visit. He has a history of hypertension, diabetes that are well controlled, and now he's here for a routine check. So you would have 2 minutes, the bell rings, you'll get 11 minutes to do history, physical examination, interpret all the lab results, come up with a diagnosis, give him tips on how to manage things, and then finally counseling about, let's say in this case, about hypertension, diabetes, and things like that. Alright, so now let's say you're inside the door. The first thing you need to do is you must knock on the door. It's a basic culture. It has nothing to do with Canada. It's a basic culture. You knock on the door, you get it. Let's say you walk in without knocking on the door, potentially can be a failure, can significantly reduce your scores. You walk in the door, you introduce yourself. See, when I walk into the patient's room, I just tell myself as, hello, I'm Dr. Rajiv Iyer. I'm an anesthesiologist and I'll be taking care of you today. That is good enough. Now, in this case, the catch is you're a doctor in your home country, but you're not a doctor in Canada. So there is a bit of controversy whether you need to introduce yourself as doctor or not. In my opinion, I would still introduce myself as a doctor because you're actually going to function like a full-time doctor when you move through all this. And you're already a doctor in your home country. So I would say I'm Dr. X, Y, and Z. I'm here to help you out. So tell me what is going on. And then the actor would start the conversation. And interestingly, when you auscultate them, you put a stethoscope on their chest. If someone has to pretend they have a rhonchi or a wheeze, they actually make some weird looking sounds. And then you say, okay, fine, you have a wheeze and most likely you might be going through an episode of asthma or whatever it is. And then there would be some lab tests. You would interpret them. You come up with a diagnosis. Then you would say, okay, you're on a well clinic visit. Now everything is fine. You just have to continue your management of hypertension, diabetes. You need to be very specific here. You cannot say, take your drugs for diabetes. You need to see, okay, fine, you're on 500 milligrams of metformin. Your blood sugar is this much. I think your blood sugar is quite high, so you may have to go up on the dose of your metformin, or you may have to add any other sulfonylureas or whatever medication it is. You have to be very clear about what those things are. You cannot be very generic. So that reduces your score as well. So you need to be very precise, and then you can explain the risks of all that can happen with hypertension, diabetes, which includes this can affect your heart, which means you're at an increased risk of having a heart attack. It can affect your kidneys, which means you're at an increased risk of having diabetic nephropathy or hypertensive nephropathy, and run the risk of increasing your chances of having a kidney failure. So you have to be very clear in assessing. Once all this is done, the examiner would start asking you questions. Okay, why do you think this is a diagnosis? What is a diagnosis? What else could be going on? And things like that. So based on this, you will receive an assessment. After 11 minutes or so, the bell rings, you step out of the room, and then you go to the next room. So this cycle continues until you're done with 10 stations. Now, years ago, there used to be 12 stations. They used to do 10 primary stations plus 2 pilot stations that wasn't scored. But now I think they are down to 10 stations. If someone has taken this NAC OSCE recently, please share your experiences in the comments below. I'm curious to know as well. Now, here are some of the things you must be very careful of. So one is, I mentioned, you're going to knock on the door. The very first thing you're going to do would be sanitize your hands. It doesn't matter how clean you are, you must sanitize your hands. This gives an indication that you really care about infection control, which is a big deal and can increase your scores. And then, before touching the patient, make sure you actually wash your hands with soap and water, okay? And dry it well. So interestingly, a scenario happened with me. So I was about to do my physical exam in my OSCE exam, and then I washed my hands. I dried with a paper towel, and then I touched the patient here because I was supposed to do a physical exam of the thyroid, I think. So I touched here, and then the actor actually wiped her face like this. So I figured, oh, my hands are still wet. Then I said, oh, I'm sorry about that. I didn't realize my hands are still wet. So let me wipe it again. So I wiped and then went back to her and then completed the exam. At that time, I knew I did really well, and that would significantly increase my score. I did not do this on purpose, but it just happened. But naturally, there was a problem, and I was able to fix it. I clearly knew once that happened that my scores went really high up. Well, I did pass on the first attempt, but I was pretty happy that happened actually. Here is another scenario I heard. So let's say one of your station has a teenage girl who is about 16, 17 years old, who now is going through a lot of stress in life. Now, I heard that there could be a man sitting inside, older man, who's now going to pretend like a young girl. I don't know how far this is true, but if you think this is true, do comment below. But if that is true, that is ridiculous, because the exam can ensure that they have the appropriate type of patients for that particular scenario. Again, if that's not true, I'm sorry about that, NAC OSCE, but I'm just saying that cannot happen. But anyway, be prepared for scenarios like this. Now, when you approach this situation, you have to be very compassionate. You have to be very empathetic. You have to relate to them. You have to ask them a lot of questions. And when you do ask them, stick to what the question is asking you to do. For example, if they say, evaluate the cardiac symptoms, don't keep asking about their rheumatoid arthritis. Don't keep asking about their foot pain, gout, and things like that. Focus. Stay focused. Sure, you're a primary care physician, you're seeing patients in your clinic. That's a different scenario, but this is an exam. They're assessing you for certain specific characters. Stick to that. What kind of specialties can you expect cases in? So usually the cases tend to be focused on medicine, surgery, pediatrics, OBGYN, psychiatry, preventive medicine, and public health. Those aspects that are relevant in Canadian healthcare. Now, they don't touch on basic sciences, but they're all focused on clinical sciences, as you can see. So you're expected to have a good understanding in terms of interpreting the patient and making sure you know what is going on. Hence, if you're someone who has done your medical school in your home country, make sure you actually do work clinically and not take a long gap, because you need to be familiar with the clinical exams and other aspects when you take this NAC OSCE exam. The next is what study resources you need. So here, they're not getting very deep in assessing your clinical knowledge. So whatever baseline clinical knowledge you have, that should be good enough. But the most important thing you need is actually a study partner or a study group where you can bounce off ideas. Now, you have to really improvise your communication skills, and you have to know what to speak, how to speak, and things like that. So if you have a group, then that can really improvise the way you can verbalize. Now, let's say you don't have access to a group. That's okay. You can catch your spouse, you can use any of your relatives in your home, and then keep telling them, sure, if they're not in medicine, they won't get what the heck you're speaking, but at least that is going to significantly improve your speaking skills. Now, you can also record yourself on a phone and then see how you speak, what you say, and things like that. So you have a self-loop feedback to improvise upon yourself. Now, what you should be careful about? You must be very sensitive to the history and to the history provided on the physical exam. If they confide in you about their mental health issues, you need to know how to receive that, how to be empathetic. It doesn't matter what your country of origin is. You have to think of a Canadian health perspective. Now, for example, let's say you have a teenage girl who's actually having issues with depression or whatever it is, then you do have to think of factors like, is it drug abuse? Is it pregnancy? Is she having really anxiety, depression, all those things? And you have to be very empathetic. You have to think like you're practicing in Canada or the US as you're approaching this, and then that is how you would successfully complete this exam. In addition to your study group, there are tons and tons of resources for preparing for NAC OSCE. You can analyze based on where you stand, what your baseline knowledge is, and things like that, and then proceed further. The other thing I would highly encourage you to do, because you're already in Canada to do this exam, you must try to visit a physical examination or a doctor's office to see how exactly the layout is. So where the stethoscope is kept, where there is an otoscope, where there is a ophthalmoscope. I'm not saying you're going to use this or not, but it's always good to be oriented with how a doctor's office is in Canada or the US, because your doctor's office in your home country might be structured very differently. Familiarity with the situation can actually really boost your confidence, and you can see, okay, how the paper towels are there, how the sinks are there. Because many of you, if you have never been to Canada, forget about familiarity with the Canadian hospital or a Canadian doctor's office. So you might actually have no clue how this is going on. Sure, there are lots of videos where you can look, but if you have a personal access, if you can, it's always a welcome approach. And that's exactly what I did. I actually spent some time. Of course, I was already a clinical fellow when I did the OSCE exam, but I did actually take extra steps in order to go to an individual office to see how it looks and then how they're structured. How is the exam scored? All right. You finish your exam, you finish your 10 stations, big relief, you go have a party that day. Now is the time to wait. You have to 8 weeks or so until they actually send the results. The Medical Council of Canada says they have a highly rigorous scoring system and a robust quality assurance process in order to assess candidates for these exams, which does make sense. So they also ensure before the release of final results that there are multiple levels of verification that is done. Because remember, this is not like the MCQ exam where everything is on a computer. There is a person component in this. There are actually people who are actually assessing this. And I also believe everything is going to be videotaped. For example, whatever the interaction that happens in that room, I think are recorded on a CCTV camera. If that's not the case, do let me know. So once the results are out, you're going to receive an email, and the email and then also the results would be uploaded on your Physicians Apply portal. So you log in, you'll be able to see the results. Now this is how the results look like. You will have access to two different types of reports. The first one is called the statement of results. This will have the overall score for the NAC exam and how much score you needed to pass the exam. Now the image you're seeing on the screen is actually a sample result from the Medical Council of Canada website. Now you also have access to what is called as a supplemental information report that you're seeing on the screen, and this provides additional feedback on your exam performance, including your subscores and a comparison to other candidates who took the exam. They do not release the results on a phone or an email. So if you get a phone call saying your results are out and here's what it is, it's probably a scam. Be careful of that. Alright, so the next question is what to do if you get a low score on your NAC OSCE. Well, as long as you pass, I think it's fine. And if you do want to improvise on your scores, there is an option of you retaking the exam all over again. Should you be doing this? Probably not. It's a lot of money, time and stress involved. But let's say you do want to do this, there is an option. And when the NAC OSCE reports your exam to your CONS residency, the most recent results would be reported. So the last thing you want to do is actually go low on your scores when you redo the exam. So be very thoughtful of whether you need to do or not. If you fail the exam, obviously there is no choice. You do have to retake it. How is the results reported? Okay, the NAC score is reported in a range between 500 to 700. On top of that, they give a mean and a standard deviation. So there are three things: range, mean, standard deviation. And finally, the fourth thing would be your actual score and the score that is required to pass the exam. So there are 5 different numbers that get reported on the NAC OSCE score report. In this example, as you can see, the range is between 500 to 700, the mean was 600, and the standard deviation was 25. So your score was right on the mean at 600, and the passing score was 577. Based on this, you did achieve a pass score because your score is now 600. Now this is how the NAC OSCE score is interpreted. Alright, see, here are some final housekeeping tips. Make sure to use study materials if you need so, if you can afford the money, but those are not always a must. It really depends on what you're comfortable with. Do arrive on time. The last thing you want to do is come late and really stress out and screw up the exam. Do not do that. And bring all the necessary identification documents, including your government issued ID, so they actually check the ID to let you in. Bring your own stethoscope, bring pens, pencils, whatever you need. If they say you must only use ours, that's fine, but at least you have your own in case something goes south. Hopefully, now you know how you can study for NAC OSCE and be successful with this exam. Now, after knowing all this, here is a video where I've told how you can move to Canada even without any exam. And do check this out. If you need any of our assistance with any of the process, you can always go to our website www.imgsecrets.com, book an appointment either with me or one of our experts. We will be more than happy to sit with you and guide you with a lot of different processes. Okay, so ultimately we give you the tools so you receive the right guidance and the right paths. Any questions, do post in the comments below. Take care, stay safe. I'll talk to you soon.